Welcome to my presentation on spinal cord injuries with Tony. Tony is a 21-year-old male who lives with his family. On screen, I have a ICF model, International Classification of Functional Disability and Health, that explains his overview. The reason for Tony's referral is he wants to improve his overall functional mobility. This includes increasing upper body strength. His overall goal is to, as seen on screen, participate in wheelchair AFL. Tony has a T3 ASIS-B spinal cord injury sustained in a motorbike incident in 2020. ASIS exam is developed by American Spinal Cord Injury Association, providing a standardized neurological assessment of spinal cord injuries. T3 ASIA-B classification is an incomplete sensory but no motor function preserved below the injury, which is around the chest area, T3 and below. It's a non-progressive injury. Damage does not worsen unless complications arise. Autonomic dysfunction is also, Tony also has, includes impaired temperature regulation, blood pressure, instability, autonomic dysreflexia, bladder and bowel control difficulties. Further medical history includes punctured lung, broken wrist. These need to be considered in programming. Pressure sores also need to be considered, as he's a wheelchair-based client. He also has one on his left hip. Facilitators, Tony appears to be motivated as for his want to improve. We see this through pursuing online education, wants employment, enjoys public speaking. We also have NDIS funding, although limited, only $6,000 for EP allocation. This is going to be split into a 12-week program that we'll speak about soon. Barriers, risk of AD, spasticity, pressure sores I spoke about. We've got to navigate communication with his family. His parents are Vietnamese born. They have limited English, which can make a care plan hard. Outcome measures summary. So as seen on screen, outcome measures were taken pre and we will take them again post. The spinal cord injury measurement assessment is a standardized assessment tool specifically designed to evaluate functional independence in individuals with spinal cord injuries. It focuses on patients' ability to perform essential daily activities such as self-care, getting dressed, all the way to mobility. Tony's score of 75 out of 100 reflects a strong level of daily function, aligning with the expectational averages for T2 to T5 spinal cord injuries. So that's within Tony's range. He's exceeded the independence cutoff score of 70 reported by Netto 2021. The 6-minute wheelchair push test is a functional capacity standardized field-based test to assess aerobic capacity and endurance, seeing how fast someone can propel the wheelchair in 6 minutes. Tony result of 440 meters, while Functional Cowan of 2012 finds that Tony results are below the typical range of 500 to 600 meters for individuals with spinal cord injuries, suggesting average to low aerobic fitness and endurance. The Modified Rhythmic Mobility Index score is a clinical assessment tool used to evaluate mobility. It has more of a focus than the SCIM assessment above on mobility. Tony scored 17 out of 40 on this test, indicating a moderate degree of physical mobility. The grip strength test is a assessment that measures the maximal isometric strength of the hand and forearm muscles. It is a good indicator or a general indicator of overall muscle strength and functional ability. Tony's grip strength was particularly strong, with a combined score of 111 between right and left, 60 on the right, 51 on the left, which exceeds the 102.5 cutoff association with functional independence and wheelchair ability in men with spinal cord injuries, as established by Netto. There is a significant difference between hands, which may be due to the fracture on his left side, which need to be considered when exercise programming. Extra assessments, I'd like to look at the ones that are on screen: wheelchair skills test, shoulder range of motion, modified Ashworth scale, and measure quadricep muscle mass through the circumference of the quad pre and post training. This is going to be affected by FES FES training, so functional electrical stimulation cycling training. Swarovski found that there was a 36% increase from a cycling training program pre and post a 12-week training block. So we want to see similar results in quadriceps circumference. Range of motion needs to be tested given there's a high load on the shoulders in wheelchair users. Early detection of limitations or impingement risks supports injury prevention. Also, his major goal of wheelchair AFL, so the wheelchair skills test, is important in achieving that goal. We're also going to use monitoring tools, rate of perceived exertion, cardio monitoring, so heart rate, blood pressure. This is important. RPE is important as a subjective measure because people with injuries above T6 may have masked HR and blood pressure responses. Safety, as seen on screen, I'll just mention a couple. Client needs to have medical clearance and ensure that medication has been taken or they have the medication on them to be taken, and GTN spray is on hand at the sessions. Relative contraindications, also asking about fatigue, training times, time of day for training, and sleep levels are important, so making sure his readiness for training is right. Goals. Tony's goals focused on enhancing wheelchair propulsion, endurance speed with an initial aim to improve 6 minutes push test from 450 to 500 meters in the first 4 weeks. By the long term, we want to aim, so 8 to 12 weeks, we want to aim for his fitness events to be up to the level of AFL. This can be seen by the agility and push performance test results and compare those to norms of the AFL level. Additionally, Tony is working to increase upper body strength and shoulder function. This begins with targeting resistance program focused on shoulder and pushing muscles, aiming for a 10% increase in grip strength. While this is achievable, this is shown by Jacob and Nash 2004. The long-term objective is to maintain shoulder integrity and avoid overuse injuries during sport and daily tasks, with 0 shoulder-related injuries as an outcome measure at the end of the 12-week training. So just quickly before goal 3, I just want to explain what functional electronic stimulation training is. It's a technique used low-level electronic currents to activate muscles that have been weakened or paralyzed during neurological conditions by applying electrodes to the skin over the specific muscle groups. FES stimulates the peripheral nerves, causing the muscles to contract. Benefits are shown on screen in the blue. Tony aims to preserve or increase his lower limb muscle mass using FES, targeting the quadriceps and glute muscles at least 3 times a week. His long-term goal is to sustain lean muscle mass and metabolic health using ongoing lower limb cycling, with the goal to have a 15 to 20% increase in quadricep circumference, which is seen as achievable by Swarovski 2013. Exercise prescriptions. So on screen you can see guidelines. We're going to use a 12-week training program to stay within budget. Hour sessions, up to 2 sessions per week, plus a home exercise session. This is found, so a 12-week program is found that training 2 to 5 times in 12 weeks can improve strength by up to 244% compared to control groups. This is found by Santos ETA 2022, which fits in with the evidence-based guidelines by Martin and Jerris ETA 2018, which recommends spinal cord injury clients should have 2 sessions per week of strength training and 30 minutes of moderate to vigorous aerobic activity 3 times per week. Phases 1 and 2 are a build towards phase 3. So on screen, you can see a Monday to Sunday breakdown. This is in phase 3, so we're building towards this sort of week. Within the strength training sessions, there's considerable build to sport-specific movements. For example, adding in cognitive elements, dual tasking, like counting backwards, different colored targets, moving targets, catching, hand-eye coordination, fine motor skills like throwing beanbags. This is all to preparing for AFL skills. The use of underhand wide grip rows, scap retraction, mobility exercises help prevent pressure sores and development of kyphotic posture through opening up the chest, improving posture due to the amount of time sitting. Posture can be poor in wheelchair users. Medicine ball side tosses and stuff like that, which is within the program, are strength and coordination exercises to help goals of playing AFL, wheelchair AFL. Gym, wheelchair obstacle course are all exercises used to improve the goal of improving wheelchair propulsion speed. Also within the home exercise sessions, shoulder health and injury prevention. SINUT ETA 2000 suggests that chronic overuse injuries in shoulders is directly linked to repetitive wheelchair propulsions and transfers, increasing rotator cuff injuries. Seated overhead reach with lateral lean are examples of exercises that can help preserve and prevent increased overuse injuries in Tony. Participation in the community wheelchair AFL group and the Achilles Disability Based Run Club, which is an actual club in Melbourne that I found, brings enjoyment to his training, helps support his physical conditioning, but his social interaction just in and overall motivation. So being social, having friends to do exercise with helps with overall motivation. Compare and contrast, multiple sclerosis is a chronic progressive autonomic condition where the immune system attacks the protective covering, the myelin of the nerves in the central nervous system. Sarah presents with relapsing remitting multiple sclerosis characterized by right side weakness, numbness, fatigue, and reduced functional capacity, impacting stair navigation, stair endurance, and weight management. Cerebral palsy is a non-progressive neurological condition. It affects movement, muscle tone, and posture. It is a non-progressive, as I said, but symptoms can change over time. Kenzie's case mainly affects muscles controlling the legs, causing stiffness and coordination issues. A stroke is a non-progressive sudden interruption of blood flow to the brain. Mr. Roberts presents post-right-sided extremic stroke with left-sided weakness. His current priorities include improving upper body dexterity, balance, cardiovascular fitness, and functional independence. So exercise 1, as seen on screen, is a seated wide grip underhand row for Tony. We're going to move for Sarah to a single arm half kneeling row. The unilateral training improves strength and asymmetry and enhances core stability, which is critical for those with MS who often experience postural instabilities and weakness, as found in Sohei 2021. For Kenzie C-piece, we're moving to standing bent knee banded row. Strengthening postural muscles helps address trunk flexion and kyphotic posture, while dynamic balance training supports functional walking and speed goals. For Mr. Roberts, seated single arm row. So for Mr. Roberts, unilateral work aids to help with neuroplasticity, similar to the cycling, which we'll speak about in a second. For Tony, motor relearning following a stroke, so having both sides, so single arm, being able to lift the same weight on each side, so we want to build towards that. Second exercise is FES cycling. For Sarah, aerobic exercise improves fatigue, cardiovascular fitness and gait, and weight management in people with MS. The use of cycling also helps with limb movement patterns and can be seen as progressive in individuals with MS, so helping with a rhythm. For Kenzie, recumbent cycling intervals enhances neuromuscular coordination, functional and lower limb movement while promoting motivation and confidence. For Mr. Roberts, we're going to do elliptical trainer and upper body support. So on the elliptical trainer supports coordination, motor recovery, and cardiovascular fitness post-stroke, so being able to find the rhythm similar to the MS. These are my references, and thank you for listening.